Okay, good morning. This is the Strategic Planning and Academic and System Oversight Committee, and the meeting is called to order. I'd like to have a motion. You have received the minutes, January 28th meeting. Had a chance to review them. Been moved and second. We approve the minutes. All those in favor indicate by saying aye. Aye. Those opposed? Motion carries. Minutes are approved. Okay. On item number 3A, we are waiting for Representative Hasner to... He's here. All right. Fantastic. Very good. At this point, I'd like to turn over to Dr. Marshall, and we have a report from the academic programs.
Yes, thank you, Mr. Chairman. We're dealing this morning with a request from Florida Atlantic University to offer an independent Doctor of Medicine program. In 2002, a University of Miami regional medical campus was established in partnership with FAU. FAU now believes that it's in their best interest and best interest of the university system for the establishment of a prospective medical and prospective medical students for the program to seek independent status. In January, the FAU Board of Trustees voted not to reaffirm the FAU University of Miami affiliation agreement. And on February 10 of this year, the FAU Board of Trustees formally approved the proposal now before the Board of Governors. The academic programs team met by conference call on the 10th of March to review and discuss the proposal at length when with FAU staff, particularly Dr. Friedland and others. After an very informative session, the team voted to recommend the proposed Doctor of Medicine forward to the Strategic Planning and Academic and System Oversight Committee for further consideration. So, Mr. Chairman, with us today to present the proposal to the full committee is Interim President John Pritchett and other representatives from FAU and the Scripps Institute.
Thank you.
Thank you so much, Governor Marshall. I would like to begin to introduce this proposal by giving you a little bit more of a historical context relative to this program. I would carry you back about 10 years ago. And of course, access to medical education was a key element for the state of Florida, but specifically on the east coast of Florida. And of course, if you go to the far south, you have the private institution, the University of Miami. If you move up the east coast, we then have the University of Florida at Gainesville, and a paucity of sites in between. So the concern for access to medical education brought the leadership of the University of Miami and Florida Atlantic University together to propose a way to increase access to medical education. And the first step in this was the establishment of a 2-year program, the 2 basic science years, in which students would enroll on the Boca Raton campus, in facilities on the Boca Raton campus. The program would be funded by the state legislature using state dollars, and indeed an appropriation of almost $5 million was made to Florida Atlantic University. At the same time, the university received its largest gift ever from the Schmidt Family Foundation, which, when matched, built the facilities to deliver this medical program. That is the Schmidt Biomedical Science Center. So with funding from the state, with facilities provided through philanthropy and from the state, the university, in association with Miami, was prepared to admit the first class of 2-year students. I would add one other thing that was unique about this public-private partnership was that the University of Miami collected the tuition from these students. And it was tuition that was charged at the rate of private school tuition as opposed to public school tuition. The first class entered in August of 2004. It was a very good partnership and a very high-quality program because after a very short time it became apparent that with the appropriate support this could be transitioned into a full 4-year program on the Boca Raton campus of Florida Atlantic University. So the University of Miami and Florida Atlantic University came together again to look at the feasibility of this. We again approached the legislature as far as the additional requisite funding. The legislature, over a period of 3 years, provided an additional $10 million for the full 4-year program. So if you put that in concert with the $5 million for the 2-year program, we were then fully funded for the 4-year program on the Boca Raton campus. And in August of 2007, we admitted our first class that was destined to become 4-year graduates. What has transpired since that period of time is the agreement with the University of Miami was due for renewal this coming June 30th. So this past September, the leadership team at Florida Atlantic University started discussing available options. And of course, one option open to the university was to re-engage with the University of Miami and continue the relationship with the University of Miami. And of course, let me emphasize again, that relationship involved the students paying private as opposed to public tuition rates. This was an option that we considered very carefully. But we also discussed other options, and one of those options dealt with the idea that Scripps, Florida, had been established on our Jupiter campus, and that there were many opportunities to interface with Scripps, Florida, relative to the development of an independent medical curriculum. The other benefit, of course, if we became independent and part of the state university system, then students within the program would pay public tuition rate as opposed to private tuition rate. And the differential is about $10,000 per year. We really explored with Scripps still further the idea of an interface between FAU and a potentially independent medical program and what the role of Scripps would be. After several meetings with the leadership of Scripps, the concept was developed, and it was really a twofold concept, that all medical students enrolled within the program would have the opportunity to work with Scripps scientists and see the medicine of the future. And we felt that this was a very unique dimension in medical education, a dimension that does not exist elsewhere within the state, or for that matter, only limited places elsewhere within the eastern United States. The second piece of this, though, had to do with training the medical scientist and the medical faculty of the future. And this would involve a joint degree program in which the degree would be an FAU MD, but also a Scripps PhD. And I might add that the Scripps PhD programs are recognized in the top 5 nationally each and every year. So basically, that is the proposal that has been developed. And to briefly summarize this, we like to classify this as moving the franchise of this program from the University of Miami to the state university system, permitting FAU to offer the degree on behalf of the state university system and to charge tuition at the public school rate of approximately $21,000 per year as opposed to $31,000 per year. But additionally, to work in concert with our great partners at Scripps to make this cutting-edge medical education. So, Governor Marshall, that is the historical context relative to our program. We have many people here today. We have people from Scripps, Harry Orff and Bill Roush, who is Dean of their graduate programs. I know they want to make a few comments in a few minutes. But we also have Representative Adam Hasner, who believes very strongly in this and is indeed supporting legislation which would enable us to do this pending your approval. Representative Hasner.
Thank you, Dr. Pritchett, and members of the Board of Governors. Thank you for indulging me the opportunity to just share a few of my thoughts with you. I guess I feel like a guy who dares to go where few legislators dare to go in coming before you, but I just felt that this was critically important. As Chancellor Brogan knows, having been such an instrumental force in the origination of the unique private-public partnership with the University of Miami, this has truly transformed our community and the delivery of health care in our community. But the opportunity that we now have in front of us is one that I think is going to put the FAU Medical School on the map nationally. To be able to have an independent medical school outside of the relationship with the University of Miami is one thing. But to be able to partner with Scripps Research Institute, I think is really going to be something that, as I said, will put Florida Atlantic University Medical School on the map nationally as one of the top institutions for the joint MD PhD program. As was mentioned, I am sponsoring legislation to authorize this independent medical school to just also reemphasize that the legislation is subject to board approval. And so I'm coming here today to ask for your consideration, to ask for your support of just that. I think it's important to point out several things, because in these tight economic times, I have been on the other side of a lot of these meetings where I have had to tell a lot of folks who have come to me in the legislature and request funding for some extremely unique and innovative programs. It is important to note that this independent spin-out, for lack of a better term, will not require any new state funding. Will not require any new state funding. I think that is something that is important to note. I think the other important factor, too, is to recognize that this is not the creation of a new medical school. That what we currently have, and something that I've been so proud to be a part of over the past several years with so many of my friends from FAU, Dr. Friedland and others, to be able to watch this program grow into a 4-year medical school program on the Boca Raton campus and graduate 64 doctors a year. This is again not a new medical school, but really the transitioning from this partnership into an independent medical school. And I would leave you with this thought, because you can talk all day long about the potential economic impacts that will be created from the synergies and research between FAU and Scripps and other institutions in Florida and around the country, but also, too, the level of prestige that this joint program, the Scripps FAU program, will lend not only to the credibility of Florida Atlantic University, but I believe to the credibility of our entire state university system. And having had the opportunity to have been a freshman legislator, it seems like just yesterday, but now in my 8th and final year due to term limits, what I would tell you is when I had that privilege to fly to La Jolla with Jeb Bush back in 2003, and to be able to work on that legislation to bring Scripps to Florida, I think, and I think you would all agree, that these are the types of partnerships that were envisioned when we brought Scripps and encouraged Scripps to come to the state of Florida. So this, I believe, is a great opportunity. I think it fits right into the focus of what FAU Medical School is doing. In terms of innovation, I think it fits right into what our state university system is looking for in terms of being recognized as a leader nationally in cutting-edge research and being able to attract the best and the brightest to our state. So with that, I would just again thank you for indulging me in the opportunity to come before you today, and more importantly, thank you for your consideration, and I certainly hope that this program can have your support. Thank you.
Thank you.
Representative Hasner, before you leave, I hope that your stay was so pleasant that when you go back, you'll encourage others.
I will share. I will share the message. I will share the message with my colleagues. There was a watch on me that if I am not back by a certain time, they are to send a rescue team. So we can avoid that. Thank you all again so much for the opportunity.
Thank you.
Thank you, Representative Hassner and President Pritchett. Do you want to call on other members of your team for comments now? You folks have covered the situation very well. And I should mention to the...
If I could beg your indulgence, Dr. Harry Orth is Vice President for Scientific Operations at Scripps, Florida. Harry has been with us, and I would simply ask that Harry make a few comments.
Thank you, and good morning. When Scripps established the operations in Florida, it was to be an institution that, like our parent in California, conducted basic biomedical research, but it was also established to do more, to combine basic biomedical research with cutting-edge technologies in robotics, computer science, and a drug development or a medicinal chemistry development platform that would allow fundamental discoveries to be taken much further along the platform and product development pipeline. And in essence, if one looks at the transition of research to clinical care, the so-called bench-to-bedside roadway, what Scripps Florida was established to do was to take basic research much further along that roadway, excuse me, right up to preclinical. And the type of faculty that we have recruited to come to Scripps Florida are world-class basic researchers, but they are also people who want to see their work have an effect on human health directly. That is part of the Scripps mantra, and at Scripps Florida, that is an even more important part of our mission. So we have recruited a number of faculty who, for most of their careers, in fact, have either worked in or in close association with medical schools, because there is that transition where basic research stops. The opportunity that was presented to us as these discussions evolved was we saw a win-win for both institutions, not just for FAU to get exposure for their medical students to the new cutting-edge technologies that will be the new medicine in 5 years, or even sooner than that, but also for the Scripps faculty who continue to want to push the boundaries of basic research and their applications to have an avenue to do that. So we saw this as a real opportunity to leverage the commitment that we made to the state to help bring bioscience here in a way that would be productive and would be an economic driver, but also improve basically the human condition for people in Florida and elsewhere. So from that perspective, we saw this as an opportunity to help fulfill part of that mission. With respect to Florida Atlantic University, I will also tell this committee that as this idea initially came to us, one of the first things that Dr. Lerner, our president, asked me was if we're really going to look seriously at this, he wanted a frank assessment from me as to our relationship with FAU. How was it working? What was FAU doing as an institution? Were they in the right direction? Is it basically an institution that Scripps would want to have a long-term affiliation with. And I was able to say unequivocally, yes. As we established operations on the FAU campus in the buildings that were for us temporary buildings that are now turned over to FAU, every aspect of our project, of all of our research and support, was dependent on FAU. Their whole support staff, all of their committees, everything that we did and got established, we were able to hit the ground running because of the amazing support that we received from the institution. It was a real partnership from day one, and that has not changed one bit since we've moved into our own facility. In fact, our Dean, Bill Roush, is a member of the academic committee in the chemistry department at FAU. We see these partnerships growing, and based on the track record that we've had over the past 4 years with them, I was able to say to President Lerner that I think this is an outstanding opportunity for both institutions, and that Scripps would benefit every bit as much as FAU in this partnership.
Thank you very much. Are there other presentations?
No, sir. We have a number of individuals here from both Scripps and FAU to answer any questions that you might have, but we'll close our presentation at this time.
Are there questions or comments from any member of the board? Yes, Mr. Edwards.
I just want to say that when we approved the new medical schools at FIU and at UCF, I think the majority of our board saw this as an opportunity for the state of Florida to become a leader not only in the country but in the world in the area of medical training and medical research. And I think this is an excellent addition to that concept. I think in a relatively short period of time, certainly within the next 5 to 10 years, you will see the state of Florida become the leading trainer of medical personnel and leading the world in medical research. And I think this is an excellent addition to that concept.
Thank you for a very useful thought. Other comments? Governor Rood.
I'd understood from the discussions that you had in your committee the other day that you were going to defer this matter. Was I mistaken in that and have another follow-up meeting?
You are not mistaken in that, but that plan has changed. Mr. Governor Martin, do you might want to comment on that?
The academic team met, and the process that we've normally have utilized on the board is have an item come out of the team to the full committee. This is a committee meeting. If this is approved at this committee level, then it would go to the full board. At that point in time, the full board would have an opportunity to vote. So today it will only be the committee members voting out the recommendation from the team, the academic team, and then the full board, at a date called by the chair, the full board would then have a discussion.
Yes, Governor?
That wasn't my understanding. I understood that we were going to recommend, again, as Governor Rood is saying, talking about this subsequently, this committee is a committee of the whole of the board. So it would seem somewhat counterintuitive to take a vote as a committee of the whole with a recommendation to take to the board as a whole if there are some changes. I have a number of questions. Unfortunately, I'm on the academic team, and it was unavailable for that call. So I still have a number of questions that I'd anticipated asking prior to a vote of either this committee or the board. And I was of the understanding that that was the plan.
I guess procedure, I want to respond to your first concern, Governor Perez. At this point, it is not a committee of the whole because I have not made any appointments from our new members. So if this committee should decide to vote this issue up or down out of the committee, it would not be a decision by the entire board. It would just be a decision by the committee members. So that's I just wanted to respond to your first concern.
Yes. Further comments?
Governor Marshall, I mean, we did meet with our, I guess you call it our academics
Program team.
program team, and we did recommend to the Strategic Planning Committee that this program be approved. So now it's really up to the Strategic Planning Committee to review that, and if you have other questions, I think you ought to ask them. But we did approve it as a committee.
All right.
Okay.
Certainly.
Academics Program Committee. I don't mean to be technical, but we
No, I said
That's
I
correct.
knew that it occurred. I simply was unavailable for that meeting, and my understanding was we weren't going to do that this morning. If we are, I've got a lot of questions to ask. And
Well, feel free to ask any questions that you might have. That's the purpose of the process coming from the academic team to the full committee. So if there are any committee members that have questions and other board members, this is an opportunity to ask questions. Yes.
I just want to, and I'm going to ask a question. I want to explore the residency. I like for the Dr. Pritchard or to explore the residency as you know, we are the net exporter of residency, and the expenses that we go through to train our kids. I want him to explore it a little bit more and explain to us how they're going to take care of the residency and go over that program whenever time is right to do that.
Okay.
I would ask Dr. Friedland if he would come forward, because he is the individual who has been working on the residency piece. We are keenly aware of the need for additional residencies in the state of Florida. And indeed, this was a very key piece to this overall proposal as we went forward. We are projecting the establishment and creation of somewhere between 200 and 300 new residencies within the state of Florida. And Dr. Friedland is the individual who has been working on that and putting that program together. Mike?
Thank you, Governors, for the opportunity to speak with you this morning. We have actually already begun in our partnership with Miami. We have started 66 new residencies in internal medicine and at JFK Hospital in Palm Beach County. We also are in the process of establishing a new surgical residency. There are talks in progress to establish an obstetrics and gynecology residency and a pediatrics residency in Palm Beach County as well. And I remember very well having this a similar discussion several years ago to talk about how this process works. And the way residencies are funded are primarily through Medicare. And Medicare has, as you know, many arcane rules and regulations. But one of the more interesting ones is that if a hospital has never had a residency program, Medicare will fund that hospital through some formula to develop residency programs as long as they are accredited by the national body that performs that accreditation process. In Palm Beach County, the majority of our hospitals, in Palm Beach County and parts of Broward County, the majority of our hospitals have never had residencies, so at this point in time, they have no caps. You've heard that phrase before. That is, hospitals that have training programs have caps. Hospitals that don't have training programs can develop them and then have a 3-year period to reach their cap. So our activity has been in hospitals that have expressed the desire to develop residency programs in much needed specialties and work closely with them and with the accrediting bodies to develop these residencies either as hospital sponsored or multi-hospital collaborations, which we happen to prefer because getting the hospitals to work together is a very important aspect of the way we want to run our program. I'd be happy to answer any specific questions.
You have a follow-up question? Certainly.
Just if you would explore to us that, so are you saying there is 200 to 300 new residencies?
Correct.
Is currently in place?
No, we plan over a 3 to 5 year period. We're going to stagger this so that everything doesn't happen at the same time. We plan to develop 200 to 300 new programs. The most important part of this is the development of first-year programs, because that's what keeps your students in your community. If you have enough first-year slots to accommodate all the students who want to apply, then they stay in the community. And so we're working very hard. Out of that 200 to 300, we anticipate at least 100 will be first-year slots.
But do you have a hard deal? I mean, do you have an agreement in place that that this will happen?
We have.
I know you're working on it, but
we have commitments from about 5 hospitals right now that they are willing to develop either separately or in partnership 50 to 100 residents per hospital. And they're attached. Those commitments in writing are attached to the materials that the Board of Governors, I believe, have distributed to the members. I can name them if you like. Boca Raton Community Hospital, JFK plans to expand its residency programs, Bethesda Medical Center, St. Mary's. We're also working with the Cleveland Clinic in Broward and have put together with them and Broward Memorial System South, I think it's called Memorial South, I'm sorry if I got the name wrong, a surgery program that just was submitted. JFK with us and Miami has submitted an application for a surgery program, and they're going to be site visited on April 21st. So we have, commitments in writing and actual action, and some of the larger systems in South Florida have committed the entire system, not just individual hospitals.
So these are additional to what they already have?
Correct.
Okay.
Correct.
Thank you.
Okay, Governor Frost.
The opportunity. I'm not a committee member yet.
No problem at all.
I feel honored to be on the Board of Governors. I first of all wanted just to comment that I think this is an incredible opportunity for the state of Florida to have this partnership between Scripps that's now here and FAU. I think we are lucky not only to be producing physicians but also researchers. I do believe in terms of the residency issue, which is an issue, and I guess it's been coming up over the last 6 months or whatever, that if Scripps and FAU were to look beyond just Broward, Palm Beach, and I believe the immediate counties, that if, and maybe you already have, if you would expand this location to include Miami-Dade, then you do have already existing residency programs with scholars working there along with, I do believe, Scripps now. I think it's with FIU, and I know it's with FAU also. So I know you've limited, or you've at least shared with us names of hospitals that are willing to get involved, which is great, and it will give us new residency programs. But we do have hospitals in Miami-Dade that are more than willing to work in conjunction with this enterprise. And if we are going to discuss those particular hospitals, we can go into that right now. And I know for a fact there are some that are more than anxious to assist you with this program. So my suggestion is only don't just limit it if you are going to be voting on this today, to just programs in that immediate area. It's only 35, 45 minutes to get down to our part of the state, and I do believe that that will address some of these issues that you're all bringing up. But I just want to say my hat's off to this group, because this will make the state of Florida very proud, I do believe. Thank you.
If I may comment, and I appreciate your comments about Miami-Dade. The dean at FIU and I have had several conversations about how we might collaborate. We haven't gotten down to the, drilled down to where we need to, but there is every expectation that we will. And we plan on partnering with other members of the SUS medical schools. We've had some conversations with the University of South Florida as well.
Right, but I mean not just with the universities, but with the hospitals like Miami Children's, Mount Sinai Hospital, etc.
And we will, we will work with the schools and the hospitals.
Okay, thank you. Thank you very much.
Certainly. Governor Perez.
Just on the residencies, and a question which I am absolutely confident the answer is we don't know, and that's a reasonable answer. So how's that for a predicate? In Washington today, there's a bill that is going to be voted on or may not be voted on, maybe presumed to be voted on, notwithstanding. It cuts $500 billion from Medicare. Do we have any concept whatsoever as to what that may do to residency funding, since, as you pointed out, we've got most of these are funded through Medicare?
I can only tell you what I think, but you're right, I don't know. I believe that graduate medical education is so important, and the recognition of healthcare shortages, not just physician shortages, but healthcare shortages and health professional shortages will, in my view, make it less likely that graduate medical education will take really big cuts. And I don't have the figure at hand. I used to know this when I was dealing with these problems about 15 years ago. The actual percentage of the total Medicare budget that graduate medical education comprises is really quite small, and I think the impact will not be large.
I just didn't know if you had any indication of what impact it may. And again, I presume that the answer, I think that's just kind of a wag number thrown out there.
Yeah.
I don't believe, I might be wrong, but I don't believe that every residency program is totally supported by Medicare. I think it helps us, and it will help us if the vote goes right in the right direction, but, it's not. Anything that they might be looking at might not just reflect, even if there is a cut in that bill up in Washington, I believe.
That's correct. Residents, the Medicare contribution to fund residents is based on complex formulas, but one of which is what the percentage of Medicare patients there are in a given hospital. So, you're right, the hospitals and other sources of funding contribute to residency support as well.
Okay, Governor Colson.
Thank you. I'm excited about the proposal. I think the opportunity to create a synergistic relationship with Scripps is exciting. I think the cost of this is nothing like starting a new medical school, but I would be to be honest, I have to say that I would be surprised if there's no additional cost, but I think the benefits outweigh whatever small additional costs we're going to see. When you came to visit with me, one of the things I'm concerned about is the clinical experience, because there's only a paragraph or two in here about that. And as I understand it, it's been taught to me, is you've got two clinical situations. You have how you're going to train your third and fourth year medical students, and then you've got to find residencies for the people when they graduate.
Right.
that residency issue, which Maury has talked about, is an issue that's troubling, I'm sure, every one of our deans of medical schools and presidents of our universities in the state. We really have to address this, or we've really wasted all this money we've spent on trying to produce doctors in the state, because they're all going to, we're going to lose a lot of them.
Yeah.
And I was under the impression that Medicare is pretty much frozen, but you told me today that if you're a new hospital, you can.
Right.
But as with regard to the third and fourth year clinical experience for your medical students, I would love just to get from you a piece of paper explaining how you intend to find physicians in the community who have an academic bent to provide that type of clinical experience to your third and fourth year students. Because I think that's where your accreditation risk is. I don't think it's on the academic, teaching. I think so I would love to see that. And then, but I also think that finding the funds for 260 residencies is going to be, they cost a lot of money, and other people, and you're not going to get them all from Medicare, and then you've got to go fund those residencies, and I don't know whether the hospitals will fund them. I don't know whether you're going to have to go find donors for them, or you're going to have to create, but that's a risk but it's a risk every medical school has. But I would love to have more detail on the third and fourth year clinical experience but other than that, I'm excited about your program.
I can give you a little bit of that detail now, if you'd like, and provide you with additional materials. At this point in our partnership with Miami, which is due to terminate in June, we developed clinical experiences in 2 community-based hospitals. Before the students started at those hospitals, the faculty the faculty in a sense voluntarily indicated their desire to teach. We have the staff to conduct faculty development programs so that the community-based physicians, which will comprise the majority of our faculty, have participated in faculty development, how to teach, the teachable moment, when and how to interact with medical students, how to evaluate medical student performance. We plan to extend that system to other hospitals that have indicated the desire to participate, and other medical staffs that have indicated their desire to participate. I might add that most of Florida, but I'll just speak about our part of Florida in particular, is really blessed with some extraordinarily well-trained physicians. And most physicians view themselves as teachers. Part of the creed that, the credo that develops during medical school and residency training is you teach. And the faculty, the medical staffs of these hospitals have continued with this philosophy. But we view as our responsibility the ability to help them understand that the teaching isn't the way it was 30 years ago or 20 years ago. We teach them about student learning habits, our ability to provide a much more clinically oriented first and second year in medical school, so that by the time the students get to the third or fourth years, they're well prepared about how to interact and contact with patients. There are a variety of hospitals, as I indicated, that have expressed their desire to participate. I do not believe we're going to have a shortage of medical staff. I might also add that during the earlier wave of medical school development that took place in the 70s, many of those schools, and there were about 30 new schools that developed, were all almost all community-based medical schools that depended on the very system that we've been talking about using in Palm Beach, Broward, and perhaps Miami-Dade. That is not unique. There are hospitals that can provide education in certain areas and not in others. That's why we want a consortium or coalition of hospitals. And that's to shift into the next component of residency training. That's also why we want a consortium for residency training. Excuse me. Not every hospital does everything, and so you can't expect every hospital to have a residency program in every specialty. So having 2 or 3 hospitals combine to, for example, pediatrics, we've been thinking about, planning on using Bethesda and St. Mary's because of their geography and because of the types of patients they have. The reimbursement, and pediatrics is a particularly tough specialty because they don't have too many Medicare patients in pediatric hospitals. The hospitals contribute in large part themselves to the development of to the funding of the residency program. Because when a hospital actually has a residency program, it gets reimbursed at different rates, higher rates, than if they don't have a residency program. And one of the things our current deans of established medical schools are struggling with gets back to the issue I had mentioned earlier. They have caps on all their training programs. And their desire is to have Washington and Medicare lift the caps. Our advantage in this whole new approach and this community-based approach is we don't have the caps. So we can go into a hospital that wants to have a residency program, that's willing to support, and it might be financial support or other types of support, but willing to develop those programs in order to improve the quality of care in their hospital and to have other opportunities for training. And if you need more third year and fourth year material that I've described today, I'd be happy to provide it for you.
I'd appreciate that. Thank you.
Yeah. Any other questions of the board members? Dr. Woodward?
Thank you, Mr. Chairman. I'll be brief. I've got a couple of questions I think will require a follow-up. First of all, you're going to graduate approximately 60 doctors a year?
Correct.
Okay. And the 200 to 300 residencies, will that cover your graduates?
Yeah. As I said early on, we plan to create enough first-year positions to actually cover more than our graduates. We'd like, we don't anticipate that every student that graduates is going to stay in our area or stay in one of our residency programs. That would be most unusual. But we plan to have enough first-year positions to accommodate them if they wanted to, but also to import physicians, graduates from other areas to fill some of those first-year slots.
Okay, where I'm going with this is I spent the day or some time at Shands last week to try to understand residency programs, and what they were telling me is the person that does their residency work in the community generally stays in that community.
Correct.
And one of our concerns, I believe, that we all have is that we generate a lot of graduates out of our programs. The majority of them leave Florida, so we're spending a huge amount of money in Florida, and other areas obviously are getting the benefit because they have the residency slots. So if we're only covering the residency program for the first year, but then in the later years they leave and go somewhere, am I missing something?
Yeah. Okay. Let me clarify a little bit for you. When I say first-year slots, that means that the students can enter, for example, a 3-year internal medicine residency, but if you don't have 60 openings in internal medicine. If all 60 wanted to go, they couldn't stay. So we need to create enough first-year slots in different specialties to give the students a wide enough choice to stay, but also to have those complete specialties. So internal medicine is 3 years, so if we're going to have, let's say, 30 slots and 30 first-year slots in internal medicine. We need 90 internal medicine slots to keep all those people in the program when they start. And so that's the way the planning process is taking place.
Okay, my last follow-up. The two-part question is on my last one. So you are not going to be taking the funding and the slots away from the other residency programs around the state. That's number one. You just confirm that. And the second part, what would keep other medical schools from developing these types of programs in new hospitals in their community, thereby providing us with more slots?
Nothing would keep them from doing that if they took that approach. If they wanted to and the hospitals were willing, and the hospitals had never had residency programs funded by Medicare, they would be perfectly open and able to do that.
And the first question of that last question was, you're not taking away funding or slots from the other existing residency programs?
No.
Okay, thank you.
Okay, Governor Perez, I think has some follow-up questions.
Yeah, just a few, and they're more, some may be very basic, and I apologize if they are. First, if you've decoupled with the University of Miami and you're not received your independent LCME accreditation, what happens to the class that's in transition right now? Are they covered in some way, shape, or form?
Yeah, the class in transition right now is our University of Miami students and will continue their education in the Palm Beach County area and graduate with University of Miami degrees. They don't lose that opportunity or ability, and the accreditation just doesn't disappear. We have also committed, and this was one of the first questions our board asked, and one of the first things that President Pritchett did was make very clear that FAU was committed to all those University of Miami students who were enrolled on our campus to have their education completed on their campus, as long as that's what the University of Miami wanted to have them do.
So the decoupling with Miami, if I'm a first-year med student,
right,
even though you're decoupled as of June,
correct,
my degree will be from UM and it's a fully accredited, so the accreditation
correct
only applies to your next year's entering class.
Our first-year class is the accreditation we would be seeking.
Great. More questions? LCME costs.
Mm-hmm.
Now, I know that we had some surprises from the UCF and the FIU LCME accreditation costs, many of those because we had to front load a whole bunch of faculty we didn't know we had to front load. And I understand that you don't have that burden. Are you expecting any sort of aberrant costs through your LCME accreditation process?
The quick answer is no. I can give you a little bit more information on that. As you, well, perhaps you don't know, the University of Miami underwent, and I love to use this word, it's octennial accreditation last February. We were part of that process, and the LCME and the University of Miami required that we submit separate data, separate databases for that program, and they made a separate site visit to our campus. And out of the several strengths that were listed under the University of Miami's accreditation was the regional campus at FAU. So we have, I would say, over 90% of the infrastructure in place. I've explained the faculty, our basic science faculty is in place. We have our physical plant, which they visited and found more than adequate. We have visited with the LCME and had discussions with them about the accreditation process. We've had consultants working with us. Everybody has a consultant working with them. And we expect no surprises in terms of finance. And again, in your packet, you'll see we've been very conservative in our financial projections, excuse me, especially the ones dealing with any sort of faculty practice or philanthropy. We've almost zeroed them out to demonstrate that we can operate the program on the current funding.
Well, that drives to my next question, and you may or may not be the right person to answer it, but at the Budget Committee meeting we were talking about next year's budget and possibly the year after that. We may be, when the federal stimulus is gone, looking at a $157 million hit plus an additional hit subsequently. I understand the representation that you can fund on current numbers and you don't need another penny. I've heard that a lot, so I'm not sure that, there's always surprises, and I understand that.
Yeah, Dr. Pritchard's getting ready to move.
Well, I figured that was the case.
Yeah,
I figured that was the case.
But before he speaks, let me comment and say that we've extracted commitments from Dr. Pritchard and others that we will not be subject to some of the budget cuts.
Let me go ahead and address that. Our Board of Trustees has unanimously voted that we go in this direction. I am not going to make any recommendations to our Board of Trustees relative to budget for the coming year that is going to put this program in danger. And that's about all I can say about that. This is a new initiative. We're not only looking 2 or 3 years hence, we are looking 10 years hence, and we feel now is the time to go forward.
So, Dr. Pritchard, you're prepared in the event of a very tough year next year if the stimulus funding isn't replaced. How are your reserves? What's the status of the university's reserves to cover some of these shortfalls?
We have budget reduction processes that our senior leadership team is looking at. In the past years, when we have done budget reductions, we have not spread those like peanut butter throughout the university. We have established priorities, and we have protected those priorities. This is a priority program for Florida Atlantic University.
And do we have sufficient reserves to help cover through some of the challenges? Or will it all be a function of budget reduction or a combination of the both? My concern is that I want to be as clear as possible. I'm thrilled with this prospect. I think the partnership with Scripps is extraordinary, and I thank Dr. Orff for briefing me the day I was down there and being here today. I think this is an extraordinary opportunity for the state, but I also am hearing there won't be any new money required, which means we can make it with what we're making it. And I think we're talking about some possible extraordinary challenges in the next year or two on the budget front.
We have been talking about those challenges for the past 2 years.
And we've been enduring them for the past year. I understand that.
Correct.
But moving forward, I'm wondering if there is sufficient reserve or a plan in place, if there's not sufficient reserve, to make certain that this works as we try to then move through this cycle, which hopefully next year will be the worst.
Let me succinctly answer that by saying yes, this will be one of the university's priorities.
I haven't gotten a reserve answer yet from you, but
different universities, have different reserve values and whatever, and what we count as reserves. We have alternative sources of funding within the university that could be shifted to cover holes. We are considering that at this point in time, but we have made no decisions and we have made no recommendations to our Board of Trustees.
All right.
Okay. Governor Sloan.
This is a great opportunity, the partnership with Scripps, but
I can barely hear you, Judy.
oh, sorry. I also think This is a great opportunity, the partnership with Scripps and the research potential that's there. But this last exchange just all of a sudden caught my attention. What will be the impact on other programs on your campus should we sustain some major budgetary kind of crisis here in the next 2 years? When you say you have other resources, will we be taking from Peter to support Paul, this new medical program?
No, ma'am. We have put a firewall around this program. We don't propose to cut this program any further, and they have taken some reductions in the past 2 years.
But which program? I'm thinking about the other programs at the institution, your other academic programs, history, English, communications. Are we going to be cutting back there in order to support the medical program?
No, ma'am, I don't believe so.
Could I make a comment since I'm coming? The one thing that I think we're missing a little bit is that this program, had they continued with the partnership, wouldn't even be back here. We wouldn't even have these conversations. I mean, nothing. The only difference is that they're decoupling their partnership and they're moving into a new partnership with Scripps. Now, when I say only difference, I don't mean it quite that way. But I think, as a former chair of that board, the medical school is seen as all of the other schools are seen. And if next year or the year after, this university or UCF or FSU, if they have to make cuts, is probably going to be somewhat across the board, and that would be what I think what is coming out of this. There may be a situation where they look at the medical school and say, we have to preserve this position going forward because we can't go below it. But this issue would come up whether or not they stayed in the partnership or didn't stay in the partnership.
Can I ask a question about that?
Sure. Can I just continue the answer? Perhaps, hopefully preempt your question. We will be collecting tuition. We're not collecting tuition now, and that is going to be in the neighborhood of an additional $6 to $8 million added to our current state appropriation. And we'll be coming back to the board to ask for permission to establish a practice plan, and we anticipate being able to generate, I won't say an overwhelming amount of income, but a substantial amount of income out of practice plan funds as well. It's not clear how much money would get generated out of research. It never is, but that's a possibility. So that I think we have alternative sources of income for the program in medicine that other programs don't have, and that we will take advantage of. I'm sorry for...
No, and that's helpful because when I was down there, we had talked about the tuition being a streamlining factor as well as additional grants and opportunities. Governor Tripp said that the only difference is the decoupling. Under your current agreement with UM, when budget cuts come in or are impacted, do they bear the brunt of those now, or do you bear the brunt of those now?
No, we bear the brunt.
Yeah, I was just going to say, to the greatest degree possible, we're going to try to stay out of this, but I've got a little experience with this particular program, and I've been sitting here thinking how to characterize this. I can't emphasize enough what Governor Tripp just said, and that includes the residencies. When this board, or the members of the board at that time, approved the original 4-year partnership with the University of Miami, there was a commitment then to the residency slots. And the plan that Dr. Friedland has been outlining was predicated upon that original plan and the commitment to those slots. That hasn't changed a bit. Right. Those 200 to 300 slots are the same 200 to 300 slots that were committed to under the original plan, and that they would be put in place in Palm Beach and Broward and perhaps Miami-Dade, but that general geographic vicinity, that has not changed. The issue of budget cuts, and this goes to the heart, I think, of Governor Solano's question, they have faced budget cuts. We all have. All the existing medical schools and medical education programs, and those cuts have had to have been absorbed while I was there, sadly, had to be absorbed by not just Florida Atlantic University, but they took their proportionate share of budget reductions. One way they did that in a couple of cases was to use the number of incoming students rather as a spigot to be able to reduce, in a couple of cases, the number of new students they brought into the program early on. So I think it's important to remember, and it comes under the aegis of not a new medical school, that the residency slots, the way they deal with budget reductions and have historically, the issue of the LCME accreditation, we've talked about it. There may be some additional, I think Governor Perez, you might have mentioned this or asked this, there might be some additional requirements laid on Florida Atlantic University regarding LCME accreditation not covered by the University of Miami in the area of student support, student services. That's all factored into the budget that they have created that would, again, be supported by the additional tuition that they now do not receive. So again, I'm sensitive to all these exact things that you are all talking about that are built into this and that have historically been handled, because we've had to, as a matter of course, by the program. I'd never want to give anybody the indication when people say this won't cost any more money. Everything always ends up costing more money. This program, even as a partnership with the University of Miami, had it not changed, would probably ultimately have cost more money if, in fact, the appropriation to support it remained the same and the program cost continue, as inflation does, drive up the cost of the program. So, you know, I don't believe they build it, nor should they, as the program won't cost us more money ever, any more than any other existing program, even if it stayed stagnant, would at some point in time probably cost more money, because the stagnant costs of the program don't bear the weight of the program as it exists in future years. So to that end, I'm not trying to do your job for you, but I do have a little experience on this one. And I had, by the way, Governor Perez, believe me, when I was president, had all these same questions because much of this was occurring during my transition to this particular position, and these were questions that I thought basic blocking and tackling questions that needed to be answered as well.
Let me follow up, Chancellor, if I might then. You said that it's the same 200 to 300 residencies that were talked about 4 years ago. How much progress has been made on those 200 to 300 in the last 4 years?
Well, we've added, as I said, we've added 66 residents in internal medicine at JFK. We have an application submitted and a site visit scheduled for about a 25 resident surgical program, and we anticipate having probably by the end of the calendar year a program in obstetrics and gynecology and pediatrics that I would estimate would probably be another 30 to 50 residents. So I think we're well on our way to meeting our commitment. I expect, frankly, to go over our commitment, but I didn't say that.
Because I was there. In conversation with many of those hospitals and hospital CEOs, it was expressed to me over and over again while I was still down there, their great desire to get involved with Florida Atlantic University's medical school. That, believe me, is not meant to be a backhand in any way, shape, or form to anybody else. I'm just telling you the conversations we had with them was they were anxious, should Florida Atlantic University be provided independent medical school status to begin those residencies that had not been begun at that point.
One other point about residency education, and again, this is all related to funding, and we talked a little bit about faculty earlier. Medicare also funds teaching and supervision of the residents. Those faculty also teach medical students. So the hospital gets funded to hire additional faculty, some full-time, some part-time. Those people also teach. And another source of, if you will, of income, perhaps not directly to the school, but to the school's mission.
I don't know that I'd build any of my business plan on Medicare funding coming over the next few years. I understand you're right, but tomorrow may be a new day in that regard.
My question is for Ari or Richard, please. If one of you guys will go up there. The reality is that this is pretty a stark contrast to our previous considerations of medical schools, and it's pretty clear that most of the board think it's a good idea, but it is a very difficult decision for the committee to make in a very short period of time. At least it feels that way. After we thought about UCF and FIU for years, it seems a little bit difficult for us to make this decision in a shorter period of time. So as I understand the timeline, it is the board at FAU that I guess made the final decision in January to decouple, I guess, or not continue with the contract with the University of Miami. So my question to Ari and Richard, as our resident experts on medical education issues, have you had an adequate opportunity to review the proposal and to vet the issues that have been submitted by the university as well as those that you've kind of heard from the committee to feel that this is a recommendation that you can make to the board to proceed with? And keeping in mind, I understand these are very special circumstances. I understand this is not a startup school, that they've had this organization in place for some time, that is a wonderful idea, but the timing of it is very interesting. So I guess answer two questions for me. First, answer the question regarding the timing you've had to vet the concept, and then second, answer the question for me of why now? That is that if we didn't make a decision about this during this time frame, what does it do to the proposal and what does it do to the program?
The answer to the first question is yes. I think that as staff, we have done due diligence on the proposal. We made a site visit. We toured the facilities both at Scripps. We, believe me, have been through the questions that you are posing now are not bad questions. They're the questions that you would want to see surfaced at this time and at this level. I think that the answers have been good, but again, most of you who worked in the area of medical education, the medical education funding that we did, understand that it is a complex set of circumstances, especially with the relationship with the federal government. I think that particularly the questions about funding that we dove a little deeper into, as you did as well, that is, what about reallocation? We understood that the $12.6 million that was associated with the program currently would go toward the program, and to that extent, the program wouldn't cost more money. We wanted to make sure that if there was a budget reduction, what would happen again? And because it's the case that you can see reallocations that are unhealthy to other programs. One of the pieces that didn't come up today, but it came up in the medical education funding at the end of the day when we talked with all of the deans of medical schools about funding and about the likelihood of seeing some more difficult years. What would they do? And one of the first things that the deans of the medical schools talk about pretty freely is that spigot issue, that they might have to take a few fewer students.
and that they had the flexibility to do so, unlike other programs in the state university system, undergraduate programs. If people come in, you have them there. You have to deal with them. Not so in medical education. We think that the program has been demonstrated to be ready and good to go. With regard to the second issue, it's really, it is the issue twofold of the accreditation that's necessary, the continued sustainability of accreditation, and moving off of the University of Miami's accreditation and onto an independent. The extent to which that is seamless, of course, is important for any students that are in that program. And that's really what FAU has attempted to accommodate by this. The other issue is that legislatively, it is a requirement that any program that offers a license, or requires, I should say, licensure to practice, whether it's nursing or something like an MD, has to be approved by the legislature also. And so, obviously, that window of opportunity is here and now with this legislative session.
Richard, do you want to add anything to that?
Well, with regard to the time that the staff has actually had to spend on this, we were actually pulled in with conversations with the university fairly early on when they started trying to develop a proposal. And we've had a lot of time with RE and I, and also Chrissy Harris, who's the budget director, to go and comb through this proposal. Now, we've done this for other universities as well when they were coming forward with, and trying to put together a proposal. So it wasn't something that we've just done for Florida Atlantic. So this was not really, it seems like a very short time period that we had to review this proposal, but we've actually had a lot more interaction with this proposal as it was being developed, and actually asked a lot of the hard questions and had them respond to it in the proposal. So.
Great.
I would like to motion to approve this item and send it to the full board.
Second. Okay, it's been moved and second. I don't want to cut off conversation. Yes, go for it.
I brought this up in our committee meeting where we also vetted a lot of these same questions, so they're all good questions. When we did the research for the new medical schools at UCF and FIU, and that was quite a few years ago, we also, and I made this request and I just want to pass it on here too, it has nothing to do with, I think we should go forward with this, but so it's not to hold us up, but when we did that, we looked at the tuition, medical school tuition for in-state students at all of our medical schools. We also looked at how we were competitive with outside the state students coming in. And I'd just like to see that updated because we all know that we have more applications for this kind of a school, for medical schools, than we have positions. So I would just like to have that information again, just so we can kind of look and see, are we competitive in-state with like Georgia or Alabama or, our competitors in bringing in out-of-state students. And, I've harped on this before, but we found at the time that we were pretty competitive. I mean, we were competitive in-state and out-of-state, whereas law school, we're still giving it away in-state. I know there are limits on how much you can raise that, but I haven't given up on that yet. But I would just like to see that information at some appropriate time.
There's not enough lawyers in the state. It's a requirement.
Governor Solano?
Hear an answer to Governor Parker's question about the agreement with Miami is over in June. So what happens, were we to say we need more time to think about this, or were we to vote no? What's the impact? I didn't hear an answer to that.
I'll ask staff to respond.
Okay. as you heard, the legislature needs to vote after approval by the Board of Governors. If that were not to happen, then approval would not happen in this legislative session. That would delay accreditation application for a year. If we were able to complete the Board of Governors review and approval process and get legislative approval, we could have our application into the LCME reviewed and receive accreditation in October and admit a class in 2011, in the fall or late summer of 2011. Failing that time frame, we're talking at least 2012. So the timing for your action is critical to us to be able to try and keep this as seamless as possible.
So if I can understand what you just said, so for the current timetable, if everything were to continue with all the necessary approvals, your first incoming class will be August of 2011.
Correct.
Okay.
Just a point of order. So let me understand what we're talking about, because walking into this meeting, I was of the opinion we weren't taking a position as a committee until our next meeting, and the board will take it up at the next meeting. Am I now hearing that we need to take a position as a committee today, and the board is going to take this up this afternoon?
No. The committee will take action today, and at a later date, there'll be a full meeting of the board, then the board will take final action.
So will that then be a special, I mean, if these deadlines are what they seem to be, if we're in the third week of the legislative session.
Yes, sir. There is a chronology to this, to your point, I think, is where you're going. There are several trigger dates. One, in order to continue, for people like Adam Hasner to continue to move the legislation forward, there has to be a decision made one way or the other so that he knows he can continue to move that process forward in what's remaining of the 60-day session. But another trigger date is the application process to LCME, and as I understand it, I don't recall the date exactly, but it's about April 15th. So that's another trigger date, Governor, that would have to be met if the board is inclined to do so. So what we have recommended to the chair is that you all take it up today, ask questions, continue to vet it, and that we would set up prior to the April 12th application deadline, hopefully as prior to as possible, to give them the ability to finalize the application, a telephonic meeting of the Board of Governors to take this issue up so that you could make a final decision, pro or con, at that particular time, somewhere around April. I think April 7th is the one that's been discussed, but that would be the chain of events. If that were to occur and everything went positively, they could file their LCME application by the deadline date and continue to move the legislation. If it were to be negative, obviously, then they would know regarding the application process and the legislation. Does that help?
So I'll call the question for this committee. Is that appropriate?
Okay, we have one more question.
That would be a little bit. One is that I see that it's coming before us at the main board meeting this afternoon. I see the agenda is...
No, sir, I'm sorry, Governor, that's changed. It will not be...
that has changed.
Yes, sir, I apologize for that. And I can understand the confusion. It will not be coming forward to you at the regularly scheduled meeting this afternoon. It would come to you at a special called meeting telephonically within the next couple of weeks. I apologize for that.
So with that, I will ask my question. I was pretty satisfied before about the residency, and the reason I'm bringing it up to bring all of us attention. I think the residency issue is huge importance to us. I have I've been on the board of one of the largest public hospitals for 8 years and 4 years as chairman. It is not easy, and it costs lots of money to have residency. We sure had a hell of a time doing that. And I've just, all the question has been asked, it just baffled me. I'm just now going back. I'd really like to see some solid response to the 4 years ago we started this program, and we still don't have one residency. From what I heard, that we have 60 coming up soon. There is another 20 is coming. Really, I like to see us and find out how. Is it maybe the hospitals are waking up that knowing, because we do have absolutely a shortage of physicians coming up. And are they waking up and they're saying, okay, we're willing to spend the money. I assure you, it will cost some money. That they're going to wake up and say, okay, we do want to help with this, and we're going to come up with a program. So 200 to 300 residency, that's a huge number of residency, which I congratulate everyone doing this. But I do like to get solid data. How is it coming? Where is it coming? And in what process?
Yeah, if I could, I think,
Governor,
no.
If I might answer that question, we
Before you
already
answer,
have 66 internal medicine residents.
I think what we need to do is have the university to actually address that issue, give us information on the status of your residency programs prior to the vote that the full board would take. That way, everyone would be comfortable with the information, and we'll all have it in hand. Now, Governor Marshall, I think, wants to close us out, and unless there are any other questions, we'll have a vote. Governor Marshall.
I just want to ask, why, if we've had all this debate here at this committee meeting, why are we delaying the vote at the full board? I mean, just because we said that earlier on, and therefore we don't want to change it, or are there other issues to be dealt with?
I guess the idea, Governor Beard, is that we had attempted to try to put some timelines in place to give the board opportunity to think about and consider the decisions that we're making. So as stated, or certainly as indicated, there's some questions that some members have asked for additional information on. Our hope is that in that time frame, they'll get the additional information and feel comfortable at a later date in making a vote up or down based upon whatever recommendation that they receive at that time. So that's the idea. The idea is that with the additional time, that there are questions that came up in your mind today that were not answered, or those that you specifically asked that it's going to take a university an opportunity to do some research to respond to, that you would do that. And then by the time we come back together via conference call meeting, that those answers would have been provided, and then we can vote as a full board on the issue.
Well, I'm generally okay with it, so I just...
Okay. Governor Perez has one last question.
I promise it is my last, and it's pretty simple. I would like to ask during the period, and I don't have any problem moving this forward today so that we can engage in further process. Again, I like the idea. I just want some comfort. If we could set a time perhaps with staff in the university to have a day or 2 days where university personnel will be available to take calls and just kind of answer questions that we may have. If we can just calendar those so we'll know what those days are, it might make this process go a lot easier before the conference call.
Well, we can work with staff and set the days up.
That'd be great.
That will work for you. That will be no problem.
That'd be great. Very good. Dr. Marshall.
Mr. Chairman, I've got a procedural concern here. The agenda called for a report by the academic programs team to give you our position on the program itself. And we have explored carefully with the FAU officers and Scripps people the academic merits of the program. So I was prepared to move on behalf of the academic programs team the approval of this program for submission to your committee and then consideration by the full board. So I think that has to be taken into account when somebody's going to write the minutes of this meeting at some point, and they'll want to know what happened to the report of the academic programs team, which was shown on the agenda. So would you like me to make that motion?
Yes, sir.
I move the approval of this program on behalf of the academic programs team.
Okay, so move in second. Are there any more questions?
Call the question.
Those for approval, say aye. Aye. Any opposed, same sign. It's approved, Mr. Chairman.
Thank you. It is now about 5 minutes to 1. We're going to take a break for how long?
That motion was out of order.
Well, now Governor Barnes would probably renew his motion, and I would second it again.
I would like to renew my motion to forward this for the full board approval.
And I second.
Okay, just move a second to recommend to the full board. All those in favor, say aye.
Aye.
All opposed? Okay, motion carries.
Yes, and in order to kind of keep us in somewhat of the schedule that we have provided in our agenda, I delayed lunch for just about 30 minutes with the idea that instead of you having a full hour for lunch, you're going to have about 30 minutes for lunch now. So it is, I'm going to ask that you resist the temptation to have a lot of conversation between now and the lunchroom. And if you would, try to go ahead and move quickly over to the lunchroom. And then when we come back, we'll finish the balance of the Strategic Planning Committee meeting and then go to the full board meeting. So if we can come back by 12:30, by 1:30, excuse me, we'll get started.
We'll convene at 1:30.
Right, at 1:30, right.